Welcome to another video on common dental issues. So today we're going to look into a considerable social problem, that is bad breath. It's also known as halitosis or oral malodor. Now bad breath can be quite embarrassing. It is estimated that over 50% of the population experience this at some point in their life. So often people are unaware and do not seek any advice regarding this. So in most of the cases, the cause of bad breath is from the mouth. Now, volatile sulfur compounds, also known as VSCs, are mainly responsible for bad breath. These are produced by bacterial activity. They're mainly produced by anaerobic bacteria, that is, bacteria that do not need oxygen for growth. So how do you check for bad breath? Now here are a few methods how you can check effectively for bad breath. Method 1. Ask a family member or a close friend. Now this is quite tricky, but it is the best method. Try and find someone who will not judge you and who is quite honest with you. It can be a difficult conversation, so bring up the topic delicately. For all you know, they might have already noticed it before but are too polite to tell you about your bad breath. Now while you're having this assessed, make sure there's at least 30 centimeter distance between you and the other person. Method 2. Lick the inner portion of your wrist. Wait for about 5 to 10 seconds. Allow the saliva to dry and then smell your wrist. Now this gives you a fairly good idea of what your breath might smell like. Now try and avoid doing this just after you've brushed your teeth or used a mouthwash or have eaten something minty, because this may not provide an accurate result. Method 3. Use a cotton swab and wipe over the back portion of your tongue. Wait for 1 to 2 seconds and then smell the swab. And this should give you a fairly accurate sense of how your breath smells. And this is more accurate than method 2 because bacteria tend to aggregate near the back of your mouth. So now let's explore the different causes for bad breath. It could be intraoral or extraoral. It could be momentary, that is just lasting for a few hours, or it could be long-standing, lasting for days, months, or even years. So a persistent malodor indicates that there could be some kind of underlying pathology. So cause number 1, which is one of the most common causes, is dietary habits. So if you're consuming things like garlic, onion, cheese, or alcoholic beverages or coffee, then you could have a bit of unpleasant breath for some time, but this does not last for too long. We'll discuss ways on how to manage this later on in this video. Cause number 2 is coating or deposits on your tongue. Now the tongue is not a flat surface. It's got many depressions, and these are ideal spots for bacterial growth. Now bacteria, they putrefy food that gets trapped in these areas and release volatile sulfur compounds, which is the main reason for bad breath. So make sure you're cleaning your tongue. Okay, the third cause is food trapped in between your teeth or beneath flaps. If teeth are not cleaned effectively, then the food or plaque that's trapped will lead to oral malodor. Now remember, 1 gram of plaque contains about 10 to the power 11 bacteria. That's quite a lot of bacteria. Thus, it's advisable to maintain good oral hygiene to keep disease at bay. Now in some cases, especially when the wisdom tooth is erupting, there might be a flap covering the tooth partially. Now this provides a nice niche for bacterial growth. So make sure you're cleaning this area out. You could use things like an interdental brush or mouthwash to keep this area clean to prevent bacterial growth. Cause number 4 is extraction wounds. After you have a tooth out, the socket is filled with a clot. Now the clot provides a framework over which your gums can grow. Now during this healing process, there will be a slight unpleasant smell from that area. This is quite normal and will take about 3 to 5 days to settle down. If you end up with a condition like dry socket, then yes, you could have foul smelling breath for up to 10 days. So we'll discuss on how to deal with a dry socket in a different video. So cause number 5 is infections. So say if you've got a dental infection and there is pus discharge, it may be accompanied by foul breath. This is again due to bacterial activity. There might also be a salty taste in the mouth. Cause number 6 is dentures. Now, if dentures are not cleaned regularly, or if you've left them in your mouth overnight, then you could develop fungal infections beneath the denture. So this can produce a typical smell associated with candidiasis. So make sure you're cleaning your denture regularly. Cause number 7 is gum disease. Now, people suffering from gum disease usually have inflamed gums and something known as pockets. Now, these pockets provide an ideal environment for anaerobic bacteria to thrive, and these bacteria are responsible for volatile sulfur compounds, which in turn cause bad breath. So it's very important to keep your gums healthy and keep any sort of gum disease at bay. Cause number 8 is dental caries. So if you've got a hole in the tooth and food is getting stuck in that area, then the bacteria in the tooth will putrefy the food, and this will cause bad breath. So make sure if you've got a hole in the tooth that you see your dentist as soon as possible to get it sorted. The other reason could be if you've lost a filling and there is a cavity, and then again food can get stuck in that area, causing bad breath. Cause number 9 is stomach disorders. This includes acid reflux, indigestion, peptic ulcers, constipation, and other bowel disorders. Now, one common thing that we get to see is malodor in patients who tend to eat too quickly. Now, when you eat too quickly, there is a lot of buildup of gases within the digestive tract. So make sure you're chewing your food well, eating small portions, and taking your time with your meals. A rushed meal might lead to swallowing too much of air, and eventually that air will get belched out as foul smelling gas. Cause number 10 is hunger or dehydration. Now, this is a temporary malodor. It usually is seen when one has gone over a long period of time without any food or drink. So also, if you're suffering from conditions such as diarrhea, vomiting, or diabetes, you might get dehydrated. The key here is keeping hydrated and eating meals on time. Cause number 11 is old age. Now, due to age, there are some metabolic changes to the supporting tissues of the teeth. Thus, there might be a slight change to breath odor. I wouldn't really classify it as malodor, but just a slight difference in the regular breath of that particular person. Cause number 12 is morning bad breath. Now, this is very common and does not necessarily indicate an underlying pathology. It's usually caused due to decreased saliva and increased bacterial activity at night. Now, it usually disappears after you brush your teeth or after you eat something. Cause number 13 is mouth breathing and dry mouth. Now, some people suffer from dry mouth due to systemic conditions, but those who breathe from their mouth can end up with a dry mouth. Now, when you have a dry mouth, there's decreased salivary flow. Because saliva is antibacterial and offers protection, when there's decreased salivary flow, the bacterial activity usually is higher. So because the bacterial activity is higher, there is more escape of volatile sulfur compounds. This explains why people suffering from dry mouth can have a foul smelling breath. Cause number 14 is ear, nose, and throat issues. Now, this includes sinusitis, pharyngitis, postnasal drip, tonsillitis, nasal polyps, etc. So it can cause malodor, and it is seen whether the patient is suffering from viral or bacterial infections. Cause number 15 is smoking or tobacco chewing or even chewing betel quid. Now, this can lead to malodor, which some people may find repulsive. the best thing to do is to stop the habit. Cause number 16 is systemic conditions. These account for less than 1% of the cases. Now, malodor can be associated with underlying conditions such as tuberculosis, cancer, acid reflux, hernia, cirrhosis, kidney failure, diabetes, etc. Now, diabetes in particular can lead to accumulation of ketones. Now, these ketone bodies have a characteristic smell. Now, this, if identified early, it can help in a diagnosis of diabetes, especially type 2 diabetes. Now that we've looked into the causes of bad breath, let's look at how to manage bad breath and how to prevent it from occurring. Now, eating well-balanced meals is important for good health. Try to consume a fiber-rich diet and also eat foods that are rich in vitamin C. And this can help keeping the airways clear as well as give you strong gums. Now, foods that support good breath are apples, ginger, melons, berries, cinnamon, fennel seeds, etc. Try and include fermented foods such as yogurt, kimchi, etc. in your diet as well, as this helps with your gut health. Now remember not to rush through your meals. Try and chew your food well, as digestion begins in the mouth. So try and savor every bite and allow the saliva to do its job. Now try and avoid processed foods, as this is primarily responsible for conditions such as indigestion, constipation, etc. So good oral hygiene is very important to keep bad breath at bay. Make sure you're using a mouthwash regularly. It's recommended to use a mouthwash at least once daily. If possible, try and rinse your mouth after every meal. You can do this with just water. Make sure you clean your tongue. It's very important to get your tongue cleaner right at the back of the tongue, because that's where bacteria tend to thrive. I prefer using a tongue cleaner compared to a toothbrush because it's got a larger surface area. The next thing that you need to do is to clean in between your teeth. Often I find patients say that I'm using an electric brush. Do I still need to clean or floss between my teeth? Yes, it is important to clean in between your teeth. You can use a floss, you can use an oral irrigator, or you can use interdental brushes. The next tip is to stay hydrated and drink plenty of water. You can add a few fresh mint leaves to your bottle of water and sip this throughout the day. It's better to take frequent sips of water than drink large amounts of water in one go. Now, to mask temporary bad breath, you could use mouth fresheners. Now, say you've eaten something with a pungent smell and you want to mask that. So you could do the following. One is you could chew gum, or you could chew on cinnamon sticks, or just a couple of cloves, or even fennel seeds. Now try and avoid chewing on the sugar-coated fennel seeds. Try and use just the plain fennel seeds, and this will leave you with a nice fresh breath. The next tip is steam inhalation. So if you're suffering from sinusitis or postnasal drip or any other respiratory problems, then you could try steam inhalation. Add a bit of eucalyptus oil to hot water and try and inhale that steam. Now this will just clear the airways and will prevent that foul smell. Now, because of certain habits, if your breath is repulsive, then now it's a good time to quit habits such as smoking or drinking too much of alcohol. So if you follow all these local measures, that is maintaining very good oral hygiene, cleaning your tongue on a regular basis, following a good diet, drinking plenty of water, and in spite of all this, if there is bad breath, then there is a chance that there might be some kind of underlying pathology. If this is the case, then it's best to see your doctor as soon as possible. And if you're suffering from gum disease, or if there are holes in your teeth or decay or caries, then you might need to see your dentist as soon as possible. I hope you found this video useful, and hopefully these tips will help you keep bad breath at bay forever. Alright, take care and see you in the next video.